I have with me Tarun Taneja. He's the Senior Vice President and Head of Products with Max Bupa Health Insurance. Tarun, thank you so much for joining us on The Money Show. Like I said, there has been a sharp rise in, I think, claims as well, respiratory related claims, because of the fact that for the last many years, the entire NCR region, we in Mumbai perhaps are mercifully blessed because we have the sea right next to us, but the NCR region and in fact many parts of the interiors of India as well have been bombarded with immense amounts of smog, leading to visibility problems and of course health problems. Have you as well in Max Bupa seen an increase in claims coming in specifically for problems related to poor air quality index?
Yeah, of course. So that is a trend that we have been seeing year on year for the last few years now. And so the claims related to respiratory disorders, they sort of double during this period. They start around Diwali time, so around end of October, and they actually go on till middle of January or February. What we see is the number of respiratory claims coming in the summers in June, July. It doubles, by the time it reaches the winter season, especially in NCR. I mean, we are seeing more than 10 claims coming in every day for the last week or 10 days in Delhi NCR alone. So it is something that is clearly affecting, the insurance holders as well.
What kind of diseases are usually associated, with, and even costs for that matter? What sort of diseases and costs are associated with living in an area with poor air quality?
See, it has short-term impact and it has long-term impact on the health. On the short-term impact, these are more respiratory disorders related to the lungs, especially for kids and for the elderly, and for people who are already suffering from asthma or bronchitis, etc. So those are the kind of ailments that we start seeing in the short term. But having said that, this has a much larger impact in the long term as well, because it does lead to heart ailments, it leads to disorders of the lungs, of the brain itself. Strokes are common because of air pollution. So the long-term impacts are much more adverse when we look at the air pollution.
I think even more scary, right? The fact that long-term impacts, that means it's here to stay with you. Any sort of associated poor air quality issue is here to stay with you, and that's, I think, even more scary. And to tackle the entire financial predicament that these diseases could put individuals in, enter health insurance. Max Bupa as well does have various kind of health insurance policies. So Tarun, first, I just want to talk about overall, and then I want to talk about Max Bupa's offerings as well. Overall, at this point, especially for people living in the NCR region, firstly, would their general mediclaim suffice to tackle the sort of menace in terms of health that an poor air quality brings about?
See, I think we should understand that as I was saying, there are short-term impact and long-term impacts. Some of the short-term, conditions that we see, a lot of them are treatable on an OPD basis, or the people do not actually need to get hospitalized for such treatments. They can be taken at the clinic or even at the hospital on an outpatient basis. The long term, of course, would have, would create the need for a hospitalization. So when you're looking at an insurance policy to cover against these kind of ailments, you should look at a policy which not only covers hospitalization, which the traditional Mediclaim policies do, but also something that gives additional coverage for outpatient benefits as well. So that is very essential for, people living in Delhi NCR at this time at least.